In today's video, I'm going to show you how to use the TENS 7000. Welcome back to my channel. If you're new here, my name is Todd Sullivan. I'm a chiropractor who specializes in treating chronic pain and muscular injuries. One product I recommend to patients if they're treating pain or muscular injuries is a TENS unit. So a TENS unit stands for transcutaneous electrical nerve stimulation. And what this does is sends an electrical impulse into the skin to help block the pain signals that go to your brain. This can be used to treat both acute and chronic pain and muscular injuries. So what I'm going to do is I'm going to show you how to use the TENS 7000 in the settings I would recommend to treat both acute and chronic pain. The TENS 7000 is the most popular TENS unit on the market. You can purchase the TENS 7000 on Amazon for about $40. So let's go over the settings I would recommend and how to use it. So the TENS 7000 is going to come with the control module. It's going to come with 2 lead wires and 4 pads. Now what you're going to want to do is you're going to want to plug the lead wires into the top of the unit here, and then you're going to connect it to one set of the pads, and then you're going to put the other lead wire in and connect it to the other set of pads. So that's channel 1 and channel 2. Each channel has 2 pads, so 4 pads total. Now when we're treating a smaller region, say as my quadricep, which I'm going to use as my example, I'm only going to use 1 channel, which is 2 sets of pads. If I'm treating a larger area, say like the lower back, I'm going to want to use 4 pads. And when treating the lower back, what we're going to do is we're going to put channel 1, we're going to use pad 1 on the upper left hand side of the low back, and pad 2 in the lower right hand of the lower back. And then we're going to use channel 2, we're going to put pad 1 on the upper right hand side, and we're going to put pad 2 on the lower left hand side. And what that's going to do, it's going to create a box, and anywhere within that box is where the treatment's going to occur. And because you're using 4 pads, you're creating a bigger box, and that's going to be more effective if we're treating a larger area. When we're treating a smaller area, you want to use 2 pads. So if we're treating, say, like the leg or forearm or shoulder, you can get away with just using 2 pads because it's a smaller region. Now when I'm treating neck pain, what I'm going to do is I'm going to put channel 1, pad 1 on the left hand side of the neck, and pad 2 on the right hand side. And typically I'm going to recommend you use 4 pads. So channel 2, you're going to put pad 1 on the left hand upper side and pad 2 on the right hand upper side. And what that's going to do is going to create a bigger area, and because the muscles in the neck originate in the mid to upper back, what that's going to do is going to treat the whole region, which is going to give you more pain relief. So to use the device, what we're going to do is we're going to take 2 pads from channel 1, and we're going to take pad 1 and we're going to put it above the knee. When we're putting it on an area, we don't want to put it right on a bony area. You typically want to put it right on a muscular area. So in this case, I'm going to put it a couple inches above my kneecap. Now pad 2 of channel 1, we're going to put higher up. Again, not on my bone of my pelvis, but we're going to put it kind of right in the belly of the muscle. So anywhere between these 2 pads is the area that's going to be treated. Now to treat an acute injury, what we're going to do is we're just going to turn on the device, and just by turning that up, okay, now it is on. And now what we're going to do is we're going to open this panel, and now you can see the different buttons. There's 4 different buttons. There's a mode button, a set button, an up and down arrow. And now we're going to put it on normal mode. Okay, now what we're going to do for an acute treatment, what we're going to do is we're going to change the pulse width to 50. So we're going to hit set, and we're going to bring this down to 50. And then we're going to hit set. And now we're going to change the pulse rate. So the pulse rate, and we want to use a setting of 80. Okay, and we're going to hit set. And now we can adjust the time. So typically between 15 to 20 minutes. So we're going to hit set. Now the device is all set up. Now what we're going to do is we're going to increase the intensity. So we're going to slowly turn that dial. And for acute setting, we want to use a light to moderate stimulation. So bring it up till you feel comfortable. You don't want a sharp pain or anything like that. So we want a light to moderate buzz, and that's going to help to block that acute pain setting and to help reduce any swelling and to accelerate the healing process. And then that's all you have to do. And all you're going to do is put the top back on. And again, if you're using a larger area, you're going to want to do the same thing for channel 2. You're going to turn that on. Channel 2 would pop up, and then you just have to change the settings for channel 2. And it's that simple. Now if you want to shut the device off, all you got to do, pop that open, and then turn this device until you hear a click, and then that's off. So those are the settings you use for an acute treatment. So you're going to use a pulse width of 50 and a pulse rate of 80, and then adjust the intensities to your tolerance. You want a light to moderate stimulation. Now to treat chronic pain, what we're going to do is we're going to turn it on. Okay, now the device is on. Now we want to adjust the settings. So again, we're going to keep it into normal mode. Okay, normal mode. Now we want a pulse width of 150. So again, pulse width is going to be how intense of a contraction is there. So that's a larger contraction going into the area because it's a chronic issue. Now we're going to hit set. Now pulse rate, we want a faster impulse into the tissue. So we're going to lower that down to 10. And you can go between 2 and 10 on this one. Typically I recommend 10. And we're gonna hit set. And then we're gonna change the time to 15 to 20 minutes. And that's it. Now what we're gonna do is we're gonna increase the intensity. Now to treat a chronic issue, you wanna bring the stimulation up to a moderate amount. You don't want it to be painful, but you do want it to be a little bit more than if you're treating an acute issue. So it should be a strong contraction, but still comfortable. Now if we're treating a larger area and we're using channel 2, you do the same thing. Just turn the settings on and you go through the same prompts to change the settings for the channel 2. But now to shut it off, all you're gonna do is turn this off. You'll hear that click, and now you know it's off. For treating chronic pain, you're gonna wanna use settings of 150 pulse width and a pulse rate of 10, and then adjust the time and the intensity. You want a moderate amount of stimulation. So those are the settings you wanna use for both acute and chronic pain. Now to recap the different settings for treating acute pain, we wanna use a pulse width of 50 and a pulse rate of 80. And then you're going to adjust the intensity of the dial based on your comfort, and you want a light to moderate amount of buzz. Now when we're treating chronic pain, we want to use a pulse width of 150 and we want to use a pulse rate of 10. And then we're going to adjust that intensity level up, and ideally you want a moderate level of stimulation. You can raise it up a little bit more depending on your tolerance level. If you have any questions, leave a comment below and I'll get back to you. And if you want to learn about the most high-tech TENS unit on the market, click that video right here.